Hello, I did my disease presentation on varicella, also known as the chicken pox. The chicken pox was a very common contagious childhood illness. Everybody knew what it was. It would produce itchy blisters throughout the body. It rarely led to anything serious though. Once an individual had chickenpox, the varicella virus is able to lay a doormat in the nerves and can reemerge as shingles. So although shingles is not life-threatening, it is characterized by the rash of the blisters. It is very rare to get varicella. Fewer than 200,000 people or cases are in the US per year. Okay. So some of the signs and symptoms of varicella. So chickenpox symptoms in adults it resembles the same as in children. But they can be more severe in adults than children. A lot of them are flu-like symptoms, as you can see on the screen. We do have fever, loss of appetite, fatigue, body aches, headache. There are the red spots that appear on the skin, the little itchy blister rash. They can spread over the entire body. So the blisters can become sores as they're healing. They do get like a crusty formation once they're healing. Let's see here. How is it transmitted? Let me go back, my bad. Okay, so transmission of varicella is through inhalation of infected respiratory secretions on contact with infectious skin lesions. The virus is spread through coughing and sneezing. This is what allows the viral containing droplets to become airborne. So VZV, it does have an incubation period of 10 to 21 days. It is most contagious through physical contact a few days before the symptoms occur. I'm going to go back really quick. I just wanted to say a few more things on this slide. I did say that it was airborne. You can also get it by kissing, sharing drinks, so through saliva, it's transmitted. I said the skin-to-skin contact, so handshakes, hugs, touching a contaminated surface. So say that somebody that had varicella had a blanket or touched a doorknob, and then you went and grabbed that blanket or doorknob. It is also transmitted through a mother to her baby by pregnancy, labor, or nursing. Just had to go back and add a few more to that slide. I am recording by myself. Let's see here. So the way that it does infect the respiratory system is that's how it enters the body. So it does enter the body through the respiratory system. You can get a lung infection. Any lung infection can lead to pneumonia. This only occurs in 1 out of 400 adults. It does result in the coughing and difficulty breathing, which can be dangerous. It also affects the nervous system. Now, this system is affected as a result of the chickenpox because the virus that causes the chickenpox stays inside the nerve cells, and the virus will stay dominant for years. So once an individual has had chickenpox, aka the varicella virus, then that's when it's able to lay doormat in the nerves and can reemerge as shingles. So as we talked about that in the beginning slide, that this is related to shingles. So shingles is not life-threatening, but it does have that painful rash and blisters. Some people that have had shingles can develop a condition called prosthetic neuralgia. Hope I said that right. And now this is what results in the pain in the skin. So even if the rash is gone, they'll still have painful skin. Shingles is most common in people over 60 and those with a weakened immune system. So a herpes zoster vaccine is available to reduce the risk of developing shingles, and we will talk about this more here as we go through the PowerPoint. Sorry, let's go back to this. I don't know if that'll stay there. It's gonna bounce out of there. Okay, so chickenpox is caused by varicella zoster virus, which is a DNA virus that is a member of the herpes virus group. After a primary infection, VZV stays in the body. So the sensory nerve ganglia stays as a latent infection. Now this means that the residence in the body of a specific infectious agent without any manifest symptoms. So the symptomless incubation period, which is in a certain disease. So that's all that means, the latent infection. Let's go to the next slide. Now this is a highly contagious but mild disease. So it has changed dramatically since the introduction of varicella, since we have had the vaccine in 1995. The United States routine childhood immunizations has reduced the disease and complications, hospital admissions, and death. So it's indicating that we do have a strong herd immunity to this disease. It occurs in a constant but relatively high rate in specific populations. Since the mode of transmission is mainly respiratory and aerosol, there is a high rate of infection in community settings such as schools. Active herpes zoster cases, they often spread varicella to susceptible people, which are usually elderly people and anyone that has not previously been exposed to the virus. Diagnosis and treatment. It's usually self-diagnosed. You see the rash and you know you have chickenpox or varicella. But when you do go to the doctors, they generally diagnose it visually. They'll look, so just an exam routine checkup. They'll look at the rash. It can also be confirmed by laboratory tests. So some of those tests do include a viral culture of the rash. They'll take a little swab, rub it over the blister or sore. Blood tests can also show that. So it is usually self-treatable if there are no complications. Some of the recommendations for chickenpox include some calamine lotion, oatmeal baths to relieve the itching, a pain reliever or fever reducer, so Tylenol, ibuprofen, Motrin. They do also say try not to scratch the blisters or scabs as they heal. Trim the fingernails, wash hands as often as possible with some antibacterial soap and warm water to help keep the rash from getting infected. If there is scratching, it can spread it and make it worse. You can get an infection that's worse. Scratching the blisters or scabs before they heal will also cause some scarring on the skin tissue. Prevention of varicella is the vaccine. Everybody knows about this vaccine. The chickenpox vaccine is the best way to prevent chickenpox. Experts from the CDC and prevention estimate that the vaccine provides complete protection from the virus for nearly 98% of individuals who receive both of the recommended doses. Now, there are 2 doses to that. The vaccine is recommended for young children, unvaccinated older children, and unvaccinated adults who have had chickenpox and are at high risk of exposure. This is one of the required vaccines in the United States. I know that a lot of people are not doing vaccines and they are getting waivers signed from schools. So we do have to make sure that we get our kids vaccinated so that we do not spread this or it doesn't come back. It is worldwide, this disease, so as long as you have the vaccination, you should be good. And I think that is all that I have.